Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained, episode number 102. I am your host, Marie Betcher, RN. On this episode, I want to talk about my list of 20 things that I would want someone to know about hospice. All of these things I have talked about before. I've just gathered them up into a list. But first, I want to mention that the Hospice Explained community is going to be open for signing up, and that is a paid community. My goal for the community groups is to help with isolation, education, and mentoring. And I will post links in my show notes. Reminder that Hospice Explained has affiliates, and if you use one of my affiliate links, Hospice Explained will get a small commission, so please and thank you. The Hospice Explained affiliates are with the Death Deck and the EOL Deck, helping you to start conversations that matter. For Death Doula School, Casey Gaconio has created a comprehensive program that will empower you to make a profound difference. And DNA is Love is offering Hospice Explained listeners a 5% discount. They have a menu of customized DNA-filled products for your loved ones or pets. All right, now we're going to talk about 20 things that I want you to know about hospice. If we just met for the first time and you started asking me questions, I want you to know. Number one, I feel it's important to learn about it before you need it. It's much harder when you have the emotional issues of an impending death of a loved one to learn. So start thinking about it, get a little understanding, or go a little deeper than just a little understanding. And this podcast can help you. Other books, talk to someone who's used the service before. Just get an idea of what hospice is. And number two, ask your doctor or medical provider questions that are SMART. SMART is an acronym for specific, measurable, achievable or attainable, relevant or realistic, and timely. So ask questions that are specific to the situation. Number three, hospice is paid for by Medicare. It's a Medicare benefit. It's also usually an insurance benefit. And I've talked about that recently on episode number 98. Number four, hospice will not take over. They're not your loved one's caregivers. A family or friend or hired person would be the caregiver. There are instances which they can be a caregiver, but it's really a specific situation and you would have to talk to them about it. And that's usually at the very, very last days. Number five, it's a multidisciplinary team. So you get more than one person. You get a team. You get usually a doctor, nurse practitioner, PA. You get a nurse, a social worker, a chaplain, a CNA, and in many cases, a therapist such as music therapy, massage therapy, or even pet therapy, and possibly aromatherapy. Number six, you can revoke. That means you can stop hospice and go back to curative care whenever you choose. So if you signed up for hospice, you can change your mind the next day. I do recommend talking it over with your medical provider or the hospice team before you make the decision, just to make sure you're making the best decision for yourself. Number seven, know the 0 to 10 scale. That's in episode number 25. And know the FLAC scale. The FLAC scale is a pediatric scale. It stands for face, legs, activity, crying, and consolability. So that helps you when somebody is nonverbal and they can't tell you about their pain. And I talk about the FLAC scale more in episode number 26. Number 8, reorder supplies or medications before you need them. Plan ahead. Don't wait to the last minute. And I talk about that more in episode number 3. Number 9, you choose the hospice company or agency. In episode 95, I discuss how to find a local hospice agency, and I will have that included also in the show notes. Number 10, if you are not happy with care, you can change to a different hospice agency. That does require you to communicate with, of course, both agencies and possibly your insurance or Medicare, but that can be assisted with social workers and staff from either hospice. And I also recommend that if you really are feeling like you're getting bad care or not getting adequate care, that you reach out to your current provider before you just automatically go look for a new one. Give them an opportunity to improve. Maybe they are not aware of your expectations. Number 11, hospice helps you manage end-of-life symptoms, such as pain, shortness of breath, anxiety, and constipation. And I talk about that in multiple episodes. Number 12, there's an on-call nurse to talk over your concerns and help you with symptom management when you don't understand these changes for the end of life. Episode number 52, I talked to Nurse Chandria. Number 13, hospice is not a 911 service, but if you want to use 911, you can revoke with hospice, meaning quit hospice. You are allowed to do that, but please call hospice before you call 911 so that they can get that paperwork started so that your Medicare or other insurance benefits will start back up. Number 14, the social workers can help you with finding lower cost funeral or cremation services. I talked about that with Lisa Paul in episode number 56. Number 15, the social workers have resources to potentially help you find caregivers. You may have to pay for them, but maybe you can get them at lower cost, sometimes free, but they can help you figure out what you qualify for. Number 16, fill out the POLST form. That's POLST. It stands for Physician's Orders for Life-Sustaining Treatment. This is a very important form to fill out for the end of life. This is important no matter where you're going to be dying. It is an order that says what you want done. Listen to episode number 6 where I talk more about the POLST form. Number 17, end-of-life paperwork, DPOA, wills, and trusts. These are also important forms to fill out and paperwork to get done. Episodes number 94 and 101, I discuss these in greater detail with my guests. Number 18, have the hard conversations, or I've recently started calling them campfire conversations, because sometimes it's not easy to look someone in the eye, and a campfire conversation, you're looking at the campfire and you bring up those subjects that you really want to know. You know, ask Dad, do you want to be buried? Do you want to be cremated? What do you want us to do with these certain belongings? You know, do you have finances or should we worry about that? Lots and lots of discussions. And you'll never know that he wanted a certain item or object given away if they don't talk about it. So I've talked about that also in episode number 5. Number 19, consider hiring a death doula or a private nurse that can be your own advocate. In multiple episodes, I've talked about this. Recently on episode number 85 with Jamie Haberman, Hospice Buddy. Also in episode number 87 with Jean Oswald. Now both of them are RNs. Also Lindy Carter, episode number 45, and Casey Gaconio, episode 59. They are both registered nurses and they are death doulas. So consider hiring one of these specialties for just you. Number 20, vacation is possible. I love talking about vacations. I love helping people plan for vacations. It's one of those things I like to do. It is possible if you're on hospice. Your hospice team can help you make these plans. So reach out to them if you're thinking about a vacation. Thank you everyone for listening to Hospice Explained. Next episode is with Dr. Tyler Sugarman. Dr. Sugarman's a vet, and we're going to talk about pet hospice. Thanks for listening. Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.